In response to the argument based on the duty of beneficence, Callahan basically argues that though doctors may have a moral duty to relieve the suffering of their patients, they also have a more fundamental duty as well, and that's the duty to promote the patient's life and health. Um, for instance, the duty to relieve suffering is not absolute. Even if a doctor could relieve a patient's suffering by, say, removing medical treatment through passive euthanasia, a doctor is not allowed to do that without the patient's consent. So again, that's just going to show that the doctor's duty to relieve suffering does not trump the doctor's duty to listen to their patients and to only engage in treatments that the patient actually recommends or requests. The duty to relieve suffering is not absolute. Moreover, Callahan points out that medical technology has gotten very good, and doctors are very good at minimizing the pain and suffering that patients experience through palliative care, right? Through medical care that, again, just attempts to minimize any pain and suffering that that patient is experiencing. Palliative care has gotten much better over time. And so we do not need to, according to Callahan, in the vast majority of cases, to resort to euthanasia or physician-assisted suicide, because we can essentially provide care for that patient till the end of their life in a way that will minimize their pain and suffering. Finally, the duty to promote life and health has historically always outweighed the duty to relieve pain and suffering. Again, the American Medical Association understands a doctor's primary duty as promoting and saving life, not taking it, even if you are taking it to relieve pain and suffering. That duty to pain and suffering cannot and ought not outweigh the duty to save and promote the life and health of the patient. So though doctors do have multiple duties, there's a hierarchy of the duties that doctors have. And at the foundation of that hierarchy, the most important duty that a doctor has is the duty to promote life and health, not relieve pain and suffering.